Living in New Mexico and being part of the community, part of my job or my goal is to try to help New Mexicans out. And seeing the problem that we have with drug overdose deaths and just families being affected by it, I want to help. Most people know somebody, a friend, a family member, a work colleague, somebody that they're close to who's either died or had problems with a substance use disorder. And unfortunately, New Mexico has a worse addiction problem than most of the country. In New Mexico, we're having over 1,000 deaths a year. That's overdose deaths across the board with all medications, but opioids make up the overwhelming majority, over 70% of those. There's a lot of hope. And I think one of the challenges of people who are in the midst of addiction is their brain is so focused on needing and wanting more that understanding what a normal life is doesn't always compute with them. I think also some of the challenge, it becomes families who are affected by a loved one who has an opioid problem often are very desperate to try to get help and desperately want help for their loved one. We can't necessarily make the loved one seek help, but we're happy to start, kind of point you in the direction of getting the help for your loved one, and same thing for the mental health that you need as well as living in that environment. I also think that it's important to be available to help New Mexicans on their terms and on their timeline, because there's a moment where people are ready for help and we don't always know when that is. And you really hate to see somebody who's interested in help today, but because they have to make an appointment, waiting 3 weeks, I want to try to minimize some of that time frame. And then for our folks in rural New Mexico, that often means that they're going to have to travel to a larger city or further out, and resources are further limited, and that's just not reasonable. So we want to try to help them in their communities as well. We have 45 years of experience here at the Poison Center dealing with poisoning emergencies. Our staff is among the highest performing of any poison center in the country. So we're the only poison center currently doing this. The Poison Center in Dallas is watching us and learning from us. People can call at no cost to them. Information is kept private under HIPAA, and that we can help them with answering their drug addiction questions. If medications are appropriate for you, we'll work with your primary doctor and so that you can get access to some of those medications. We also have fentanyl test strips. We have naloxone or Narcan that we can mail you, and we're here to help you.